We hear that term evidence-based thrown around all the time, right? Especially when we're talking about health. But what does it really mean? What does it actually take for a health program to prove it works? Well, that's exactly what we're going to get into.
Kind of sounds crazy, doesn't it? I mean, a cure is supposed to be a good thing, period. But what if our rush to embrace a new treatment, even with the absolute best intentions, actually ended up hurting people? It's not just a thought experiment, it's a real lesson we've had to learn in public health.
And that leads us to a powerful and honestly a pretty tough story about when good intentions go horribly wrong. So, picture this. It's the 1980s, and a new treatment for breast cancer comes on the scene. It's called HDC/ABMT for short, and it sounded like a game changer, a real breakthrough. So, of course, it was adopted with incredible speed and just a ton of enthusiasm. And that enthusiasm, well, this number tells the story. Before this treatment was ever properly scientifically tested, more than 30,000 women received it. 30,000. It was all running on this very powerful but very dangerous idea that, hey, this sounds good, so it must be good. And here is the heartbreaking reality. When the rigorous scientific studies were finally done, the results were devastating. The treatment wasn't just ineffective, it was actually harmful. Patients suffered more, and they died earlier. It's a tragic reminder of why we just can't rely on hope or even expert opinion alone. We needed a better system. And that better system, that is what we call the evidence-based approach. At its heart, evidence-based public health is a huge shift in thinking. It's all about moving away from gut feelings, from anecdotes, from this seems like a good idea, and instead moving toward the systematic use of data and real science. It's about asking one simple, powerful question before we act. Where's the proof? Now, a huge piece of finding that proof is understanding this difference right here. Efficacy asks, does this thing work in a perfect, sterile lab environment? But effectiveness, that's the real question for public health. It asks, does this thing actually work out in the messy, complicated real world? Think about it. A drug might have amazing efficacy in a lab, but if no one can afford it or they don't take it the right way, its effectiveness is basically zero. Okay, so if we're hunting for proof, how do we grade it? How do we know what good evidence even looks like? You have to understand that not all evidence is created equal. There's a hierarchy, kind of like a ladder. Down at the bottom, you've got things like opinions from experts. Interesting, but not ironclad proof. As you climb the ladder, the studies get more and more rigorous. And right at the very top, the gold standard, you have randomized controlled trials, or RCTs, which are the best tool we have for getting rid of bias. And what's cool is that groups like the U.S. Preventative Services Task Force take this whole hierarchy and basically turn it into a simple report card. An A or B grade, that means there's great evidence of a benefit and doctors should offer it. But a D grade, that's a warning. Discourage it. It might even be harmful. This system makes the evidence super clear and easy to use. But, of course, there's a catch. Even with that A-grade, gold standard evidence, taking an idea from a perfect lab and dropping it into the real world, that is a massive leap. This quote just nails the problem, doesn't it? We have all of this evidence-based research, but a lot of it isn't really practice-based. Will it actually work in a real community, with real budgets, real politics, and real people? That's the challenge. And that's where a tool like the RE-AIM framework comes in. It's a brilliant way to bridge that gap between the lab and real life. It forces us to ask those tough, real-world questions. It's not just about effectiveness. It asks about reach. Are we even getting to the people who need it? Adoption. Will schools or clinics actually use this thing? Implementation. Can they do it right? And maintenance. Is this going to last? This is how we figure out if an idea has real legs. So let's bring this all home. What does this mean for you and me? Well, we can boil it all down to a really simple way of looking at any health claim you hear. Is it proven? Is it promising? Or is it just emerging? This chart lays it all out. Proven interventions have the highest level of evidence behind them. We're talking multiple high-quality studies. Likely effective is a step down, but still supported by solid, peer-reviewed articles. Promising means it seems like a good idea, but it needs more research. And emerging is really at the starting line, often based more on a cool theory than on hard data. So what does a proven intervention look like in the wild? It can be something as simple as this. just putting a sign next to an elevator that nudges people to take the stairs. It sounds basic, but it's been studied again and again in all kinds of places, and the evidence is crystal clear and consistent. It works. Okay, so what about likely effective? A great example would be transportation policies that encourage physical activity, things like adding bike lanes or making sidewalks safer and more connected. We've got good scientific studies showing this has a positive impact, but the evidence might not be as rock solid or as widely reviewed as those stair signs. Now we get to promising. This is the category for ideas that just make intuitive sense, right? Like offering diabetes self-management classes at work. There's some evidence, maybe from government reports or conferences, suggesting it's a good path to follow, but it still needs more of those rigorous, controlled studies to really lock it in as proven. And finally, we have emerging. An example here might be a big mass media campaign to get people to cut down on their screen time. The theory behind it is sound, and there are probably some small pilot studies out there, but that big, definitive proof that it works across the board, it just isn't there yet. So here's the bottom line. The next time you see a headline about some miracle cure or a brand new health program, you're now armed with the right questions. What are you going to ask? Are you going to ask, where's the evidence? Are you going to ask, is this proven, just promising, or still emerging? Because asking those questions, that is the first step toward building a healthier, smarter future for all of us.